Some kids here at Franklin Beauty School getting ready to go back to school. Almost 80% of women suffer from some kind of hormonal imbalance. A practicing OBGYN, our next guest wasn't an advocate of hormone therapy at first until she started experiencing symptoms herself. Now she's helped many patients combat the ailment and feel like a whole new person. Please welcome Dr. Farina Imtiaz with Reveal Med Spa, along with her two patients, Kelly Henderson and Myra Mallett, to share their stories. Good morning. So I've had many doctors who have said they went to medical school and learned all kinds of things, but when it came to hormones, it was about 5 minutes or they skipped it altogether.
Oh, for sure. Absolutely. I think in particular, hormones for women are very, very poorly understood. We're not taught how to take care of it, and we're taught to treat symptoms and not really treat how to take care of changes related to aging for women.
So as an OBGYN, when women would come in, oftentimes after having a baby or at a certain age, and they go, oh, I'm feeling this, I'm feeling that. At first you were like, okay, here's how we treat that. Here's the medication, go away.
That's right.
And then you went through it yourself.
Yeah, so I basically started my own practice after residency, and I started seeing all these patients coming in. Everybody was tired, moody, they couldn't sleep right, they had no energy, everything just started...
Losing hair, gaining weight.
Skin's dry, you just don't feel like yourself again. Most importantly, the only things I could really treat was, oh, you know, you feel down, you don't have energy, you must be depressed. Let me give you an antidepressant. In fact, there was one point when I think I was writing probably more antidepressants than the psychiatrist next door.
Wow.
And after like 5 or 6, 7 years, I just kept seeing patients over and over every single day, and I was like,
and they weren't necessarily getting better.
They were not getting better. And so finally, when I got into my 30s, I realized I was starting to have some of those changes. You start feeling like you can't focus as much as you used to be able to. You can't remember things the way you could. You didn't have as much energy as I did when I was in my 20s.
Like nodding their heads. And so,
it's all of us.
Yeah,
it's
for
all
Kelly,
of us.
like, just go through some of the symptoms you had, because I know that there's somebody at home, when they hear this, they're going to be bing, bing, check, check, check,
oh,
check,
absolutely.
right?
Yeah. Oh, I could just be sitting at a traffic light and just start crying.
I sat at the traffic light and fell asleep.
Why am I crying?
I would time the traffic lights and go, ooh, 28.3 seconds of sleep, right? Because I was that kind of tired. But you would start crying for no reason.
For no reason. And then snapping at people, you know, and things would come out of my mouth. And I'm like, why did I just say that? And, you know, went to the doctor, you're depressed.
Yeah.
And then I got on antidepressants, and I went to work, and I'm like, this,
like a zombie.
Yeah. And people are like, what is wrong with you?
And Myra?
So for me, similar to what they've expressed, I had the mental fog. So I work in accounting and finance, and I just didn't have that same mental clarity that I once had. At the same time, fatigue, and then I didn't have night sweats. I had like torrential downpours at night. I mean, it was just absolutely, it was awful, absolutely awful. And so I just really was looking for something to make me feel better.
And then even when I was told, finally I got to a doctor, this is I think number 5. The 5th doctor said, well, I think it might be your thyroid. It sounds like thyroid. And I said, okay. They tested it, and he said, oh, well, maybe not, because you're within the range. And when they say within the range, whose range are they talking about? Right? Some man in Nova Scotia. You two aren't matching up, right? But the problem there was, instead of looking at it that way, you look at it in doing medicine, practicing medicine, is to say, what are your symptoms telling me is wrong?
Right.
And if you're having those symptoms, then you got a problem, right? Not you're not within the range, so stop having your problems.
That's right. Yeah, no, I think that was really when I started finding a solution for my patients, is the day I realized I don't have to stay within these bounds of this range.
Yeah.
Who is this range, like you said? You know, we take thousands of people, we put everybody together. Somebody may be 80 years old, somebody may be 18 years old. We lump everybody's hormones together, and God made everybody different.
Yeah. And
just
there's different things that may kick it off. Like I mentioned, mine happened after I had my son. For a lot of other women, it's right when they enter menopause, and then for some it could be perimenopause. So what do hormones do in our body? I think that's the part a lot of us misunderstand it.
Yeah. So they control everything. They control everything from the rate of growth of your hair to how your toenails grow to how your body fat distributes to how awake your brain is, how much energy you have, how you feel about everything in your body is controlled by your hormones, and hormones is really what aging is. So as your hormones decrease, or even if they're at the right level, if they're not doing the job they're supposed to do, then you've got a problem that we've got to fix. And that's what I feel is important for me to do is to listen to my patients and figure out what is it that I can do differently to make you feel better.
Yeah, and this is one of the things you do differently. Okay, we're going to close up of this right here. There's different ways to kind of deliver the hormones.
That's right.
But this right here is called the pellet therapy.
That's right.
Explain to folks what that pellet is.
So what I would do is I look at your hormone levels and try to figure out what symptoms you're having, and then it's an individualized treatment. So I'm going to figure out what do I need to alter to make you feel better.
Yeah.
And depending on that, I'll decide
Do you need a little
on what
testosterone, you need a little estrogen.
That's right. Depends on which hormone you need. The hormones I deliver usually are through pellet therapy.
That's a
pellet
small
is this
one right
little
here.
pellet right there, and next to it is actually just Tylenol. It's not a
Yeah,
horse
just to give you
pill.
an idea of the size of this pellet.
That's
Yeah.
right. So just in comparison, it's a very, very tiny pellet. It feels like a shot to the patient. You don't. Once I put it in, you don't feel it.
Yeah.
You don't see it. You don't know it's there, and it's time release. So
It's
the
inserted
levels,
underneath the skin.
that's right. And so the hormone levels are very, very stable. They don't fluctuate. And one thing I've learned about hormones, the ups and downs is really what causes the mood changes. So this is a very, very stable delivery system.
Yeah, because your body calls on it when it needs it, right?
That's right.
And it's there. It's amazing that it just takes just that much, right?
Just that little
All
much,
right.
yeah.
So, and how long does that pellet last in the body?
3.5 months for women, 4 to 6 months for men.
Okay. So the difference after having your therapy.
Oh, it's a game changer. Totally. I mean, I laugh now, I sleep. I mean, I was waking up 3 o'clock in the morning every day.
Oh, yeah. Well, it's crazy because you'd be
It's
fatigued,
like-
so tired, you could not wait to make it to your bed. Like I said, I was
Right.
falling asleep at stoplights. But when I laid there, it was like all of a sudden, okay, go to sleep now. Okay, go to sleep. I couldn't sleep.
Right.
And I know that was working because it was the first night I actually woke up the next morning and I slept throughout the
Yeah,
night.
and not sweating, and oh, it's awesome.
Yeah.
It's
yeah.
awesome.
For you?
Same thing. My husband should be here to testify to how much of a difference it made. I mean, and it's almost immediate. You just notice, like within the first couple of weeks, a total difference in how you feel. Feel more energetic. I'm over 40 now, and I was feeling like I was 25 again.
Yeah,
so
yeah.
it was
So
really
basically
great.
what you do is you have to reveal new women or the woman that you used to be, right? And that's kind of the philosophy behind Reveal Med Spa.
That's right. That's right. So I am a gynecologist, and I treat women of all ages, but mainly my interest is hormone replacement therapy. I also deal with GYN procedures for rejuvenation. One of the things we didn't talk about with the pellet is really one of the only treatments for improving libido for women. Female libido, very, very poorly understood, and that's really what our focus is trying to find out how can we help you feel better.
Yeah, you can go from like, I just love my husband to stop looking at me.
That's right.
Do not
That's
even
right.
look at me. But yeah, because I think a lot of people are confused too that women do produce a little testosterone,
That's
not
right.
as much as men, but that's kind of the thing that gives us the wow feeling,
That's
right?
right.
Yeah.
And if you measure the amount of hormones in our body, we actually have more testosterone in our body than we do estrogen.
Oh, wow.
Yeah. So when our testosterone levels start decreasing, we just don't feel right. The mood changes are the first thing, but libido really takes a big hit.
Yeah.
And fixing your hormone levels will really help improve your libido as well.
Okay, we'll get the husbands back next time.
That's right.
Thank you very much.
Oh, thank you.
Book an appointment with Dr. Imtiaz, and for more information on hormone replacement therapy, call 281-861-1100, 281-861-1100, or visit HoustonReveal.com. When it